2, 3, 4, safe staffing on the floor. 5, 6, 7, 8, Pomona, negotiate. 1, 2, 3, 4, safe staffing on the floor. 5, 6, 7, 8, Pomona, negotiate.
Union nurses at Pomona Valley Hospital Medical Center walked off the job today. The picket lines went up early this morning. Nurses say they're on a 5-day strike to protest what they call unfair pay and unsafe staffing levels. The union wants a 5% salary increase for each of the next 3 years and a smaller nurse-to-patient ratio.
Patients come in here and they deserve to be taken care of. We are patient advocates as RNs. I take that job extremely seriously, and I wouldn't be here if it wasn't about patients.
What do we want? Contract! When do we want it? Now! What do we want?
We have wonderful nurses here at this hospital, and they all want to be inside working, but we are here to take a stand for safe patient care. Whether this administration wants to admit it or not, we have some serious issues on many floors in our hospital. You know, in a minute, we would go back to that bargaining table. Even after giving up free health care for 660 nurses, we have 2/3 of the nurses at our hospital that are less than 10 years experience here at this hospital. And they have given up their free health care so that we can come out here and bargain for safe patient care. That was a huge give up on our part. You know, this would have benefited many of our nurses, and our CEO has no respect for that particular matter.
According to the nurses union contract, talks have stalled after 5 months of negotiations.
They believe they're staffed appropriately. We believe the nurses who are at the bedside 24 hours a day, 7 days a week, know better what's necessary.
I'm out here because I'm supporting my co-workers and myself also. There's policies here that need to be changed. There's staffing ratios that need to be changed. The nurses are here to help their patients, and they want to give the best care for their patients. They want to protect their licenses, protect their hospital, protect their reputations.
I started nursing school on Thursday, and I want to be a nurse. And I'm going into nursing for patient care and to be part of a community that's dedicated to helping other people. And so when I hear that nurses are being forced to act as though they are business people and have to make decisions based on finances, it doesn't resonate with why I'm going into nursing. So I want to get out here, learn what the issues are from the nurses before I become a nurse, and also stand with them for my future patients and my future colleagues and myself.
What do we want? When do we want it? Now! What do we want? When do we want it? Now! What do we want? When do we want?
I know that they're pulling on your heartstrings, and I know the pettiness of not giving you your fare tickets. Shame on them.
And that from Pomona's mayor on the front line, speaking specifically to allegations that the nurse-to-patient ratios are just way out of line. And in terms of just what that means, less than adequate care, they say.
We have a good hospital, and we want to keep our hospital the best it can
be. Thank you to the nurses here today for your courage, for the sacrifice, and for the risks that you are taking. Because you take them, I know, first comes you and your family as it should be. But second is, we need you to stand up for patients. Because we know that you have patients at the top of your list, whereas we know management does not put patients at the top of their list. And also we need you to set a standard. We need a standard in this industry for patients, we need a standard for nurses, and we need a standard that goes beyond this hospital.
What do we want?
Contract!
When do we want it?
Now! You are the health care reform! And health care reform should be in the hospitals with the patients! Not being kicked out onto the streets in order to ask for what?
for health care, for ourselves and our family. You provide the health care for us. Nobody should deny the health care and the dignity and the benefits for you and your family. Somehow, this year of healthcare reform has gone a little bit awry when the people who provide the patient care are out on the streets. And the administrators and the strike breakers are on the inside.
Good working conditions, more wages, absolutely, because we're below standard at this facility, you know. But what we need is to have our standards raised so that we can not only recruit but retain nurses. We shouldn't be paying nurses $10,000 bonuses, training them for a year, and they go somewhere else to make better wages and get free family medical. We want those nurses to stay in our facility that have been trained by our seasoned nurses. We want them to stay here for as long as some of us have been here. We want them to take care of the patients from the community. And our patients deserve to be given the best possible care by the best possible nurses. And we're not doing that right now.
We want what's safe for our patients. We want what's safe for the nurses. We want to protect our licenses. We want to protect the lives of our patients. Your family members, the community, please come out, see what's happening. Listen to what the hospital has to say. We're in a democracy, okay? There's two sides. We have our side, the hospital has a side. Listen, fester that in there, and please form an opinion, and please do what your gut feeling tells you, what your heart tells you. But basically what we want is just a safe environment for our patients and a safe environment for us.